For more than 50 years, Windsor residents had been drinking fluoride in their tap water. But not anymore. After public debate and council consideration, fluoride will no longer flow freely from Windsor taps. And joining us now in Windsor, Ontario, to tell us about the decision, Bill Marra. He is the City Councillor for Ward 8. And Bill, we welcome you to the program. How are you tonight?
Very well. Thank you, Steve.
Let's just do a bit of background here. You had a special City Council meeting on the 28th of January. Councillors and the Mayor voted 8-3 in favour of ending the fluoride in the water system after 50-plus years. Let's start by having you tell us, how did this issue come before Council in the first place?
Well, you know, it's an issue that in the many years I've been on Council has been talked about in the community. There have been a number of groups that have developed and really made it their business to bring this issue forward. But let me tell you how this particular decision came to bear. It actually happened about a year ago. In February of 2012, Steve, the Windsor Utilities Commission had a public meeting, and it was to have a discussion and a debate over the issue of fluoridation. As you indicated in your opening, it's been public policy for over 5 decades. That meeting took place in February of 2012, and the recommendation that came from that meeting was that City Council remove fluoridation from the water supply. We then had an 11-month period, an extended period of time where there was considerable public input, and I can assure you that we heard literally from hundreds of folks across this community over a period of about 11 months. We heard from a lot of medical groups and special interest groups as well, citizens groups, and the meeting came to bear in January before City Council. So we had an opportunity to hear from 27 delegations. We had over 80 submissions from a number of different groups and individuals, and we debated this for several hours during the evening of January 28th.
And tell us more about those groups and individuals. Who were the kinds of people who wanted the fluoride out of the water?
You know, you won't be surprised. We had a number of citizens groups that have come forward, and I was really thoroughly impressed with how well researched they were and how much information they had provided to Council, not just that evening, and I keep emphasizing this, even over the 11-month period. So it wasn't something that was decided simply based on one public meeting. We heard from the medical community as well. We heard from representatives that came from the Dental Association. We heard from our public health unit here in the Windsor-Essex area. And we heard some considerable debate on both sides of the issues. We even had submissions, written submissions from folks from the medical profession that were not supporting the continuation of fluoridation.
What was the
and that's
nature
really
of those
interesting.
Complaints?
Pardon me?
What was the nature of those complaints? Why do they want the fluoride out?
Well, really, we heard a couple different things. We heard, first of all, that there's never been any clinical trials to determine whether there's any benefits from fluoridation or whether there are harmful issues associated with it. We heard from folks who made really a simple statement. Why should 100% of the population be exposed to fluoridation when there's a lot of concerns around how fluoridation takes place? And that's really where the crux of the argument was around the hydrofluorosilicic acid process. What is it that's going into the water? It's not a naturally occurring fluoride. Now, Council needs to be careful when you get into these discussions. We're not doctors, we're not scientists, so it was really critically important that we keep this at a very high level and talk about it in the context of sound public policy. And from my perspective, there was enough doubt and concern raised that this policy needed to be revisited. There are concerns around what it is exactly that's being used for the fluoridation of water. That was probably the primary issue that was debated considerably. And I thought it was rather interesting that no one could produce any clinical trials that could either speak to the benefits or the harm of the fluoridation process. And the other part for me, Steve, and I asked this question really towards the end of the debate, we heard from a number of public health organizations. They were either provincial or federal. We heard certainly from a number of dentists. And the question that I asked them is, if these public health organizations that are provincially or federally funded feel strongly about this, and if the federal and provincial governments feel this strongly about it, then why after 5 or 6 or 7 decades has it never been considered in the context of legislation? Why are they leaving it as an option to municipal governments? Our goal in a municipality is to provide clean drinking water, clean, safe drinking water. And from my perspective, I think we've come a long way over the last 5 decades, and I think the issue of fluoridation needed to be revisited. I'm pleased with the outcome.
Okay, let me ask you about your position on this. At the beginning of all this, before that February 12th meeting at the Utility Commission a year ago, what was your view on fluoridating the water?
I was very open-minded going into it. This was not an issue that I championed to bring forward. Let me assure you of that. We've got a number of other priorities, I thought at the time, here in the City of Windsor. But really, it was that first public meeting through the Windsor Utilities Commission that got me thinking about it, because the folks that were there, the delegations that were there, raised enough questions and doubt in my mind that this issue had to go before council. I didn't think that in February of 2012 the medical community did a good job. They weren't able to respond to questions around the lack of clinical trials. They weren't able to respond to some issues around the fluoridation process. We heard from organizations like the Canadian Pediatric Society, for example. They issue warnings around the use of baby formula to ensure that you don't use water that has fluoride in it. So when these issues came up, the medical community didn't really do a very good job responding to those concerns and questions.
And so
automatically it raises doubts. It raises a red flag.
So you voted to take the water out, the fluoride out of the water, rather.
I voted that way, and the critics are saying that, listen here, this is a policy that's served us well over the years. We have some individuals that are vulnerable in our community, and in the Windsor-Essex area, they're suggesting 28 to 30% of the population, Steve, will become at risk. In other words, they need the fluoride in order to take care of some dental issues or oral hygiene. And I think where we need to focus our strategy is on providing better public education and resources to those individuals who don't have the economic ability to take care of their own health issues.
Okay, let me read you something that was presented for your interest and consideration by Arlene King, who's the Chief Medical Officer of Health for the province of Ontario, who wrote, "I am very concerned about the potential loss of fluoridated water in your community, in spite of consistent evidence that water fluoridation is safe and effective. The practice of water fluoridation is the subject of some controversy, but the science is clear. Since 1997, there have been 18 major reviews examining fluoridation, including an expert panel convened by Health Canada in 2007. These reviews have consistently found that fluoridation is effective in reducing the risk of tooth decay and is the most cost-effective way of providing the benefits of fluoride to all residents of a community, regardless of age, socioeconomic status, education, employment, or dental insurance status. Studies show that when fluoride is added to water at recommended levels in Ontario and across the country, it is not linked to adverse health effects." That's pretty categorical. What about that did you find ambiguous?
Well, I didn't find it ambiguous. The question in response to that was this: where are the clinical trials? There are reviews that are done, and there's been some considerable debate over those reviews and some interpretation by others. And again, Steve, I tread carefully because I don't have a medical or scientific background. I really wanted to continue my discussion on this around sound public policy. But we needed, in my opinion, clinical evidence and clinical trials.
Why clinical trials as opposed to just studies, which numerous ones have been done?
As I understand it, clinical trials will provide you absolute evidence that's peer-reviewed and it's looked at by the appropriate parties. And from what I understand, they provide much more enhanced evidence than simple reviews. That's what we were told, and I subscribe to that argument. I thought it raised enough doubt and concern in my mind. But I want to share something else with you that's not medical, it's not scientific, and some might argue anecdotal, but I think it's relevant as a public official. I heard from my community over a period of 11 months as this issue was ramping up and leading up to the council meeting. And I can tell you easily 75 to 80% of the folks that I heard from, the people that live in this community, simply want the choice, the option to whether or not they should have fluoride in their water or not. It was the vast majority of persons. The average Windsorite here said to us, I don't want it anymore. We've come a long way, and if there is a population of 28 to 30% that require it, there are other strategies available. This was certainly not an economic decision because the cost of fluoridation is minuscule compared to these multi-million-dollar operating budgets for water treatment facilities. So that's what we did. We based it on some concerns that were expressed to us. I think some very valid red flags were raised around the evidence that's out there, and we joined many other municipalities across this country, in fact, across North America, and removing fluoride, or the fluoridation process rather, from the water treatment. Now, we will take the next 5 years to understand the implications, Steve, and that's also an important part of this discussion. We didn't just simply say, let's remove the fluoridation process. We've done it for a period of 5 years because we want to study any potential concerns that might evolve from this. We're going to ensure that the public health unit has the proper resources to deal with some of the folks of our community that require some additional support.
Well, that's
and
my
we're going to be
next question.
responsible about this.
What are the options for them now to stop the tooth decay for the almost 1/3 of the people for whom this presumably would have been very helpful?
There are a number of options available to them. I think they need to continue running those outstanding programs that they do already in Windsor-Essex, and and I suspect they're the same across Ontario. They work with schools, they work with social agencies and other groups that deal with the less fortunate, perhaps folks that have less resources, or perhaps folks that are simply not as educated as they should be. So they're going to continue their dental programs. If we have to enhance them, we'll certainly provide them the resources. In fact, one of the suggestions was that we reallocate the $150,000 or so a year that's used for fluoridation, give it to the public health unit so that they can put it to good use as well. And I think public education, I think parents, educators, the adults of this community, like every other community across this province, they have to take the responsible position to make sure that children especially are educated on proper oral hygiene and they have what it is that they need. Those are the kinds of strategies that we should continue to employ.
Just in our last couple of minutes here, I wonder whether or not, Councillor, you're at all worried that you guys, I'm going to put this in a pleasant way and then a harsh way, that
Sure.
you look anti-science to the rest of the world, or even worse, that you look like idiots to the rest of the world for doing something that has been kind of very conventional wisdom for a half a century.
I'm not worried about that at all, and I'll speak for myself. I'll get back to the points I made earlier. I don't think the medical community made a strong enough argument to convince Council with absolute certainty that this public policy needs to stay in place in order to address all the issues around oral hygiene or dental hygiene. There are numerous other opportunities available to cities, and I know this is spread throughout Europe, to deal with these issues that weren't available 50 or 60 years ago. What I found strange, as this issue evolved, Steve, was that this was a policy that was in place for so many decades, yet no one had the desire to revisit it or have a discussion. I thought it was a healthy discussion. I think it reflects how people in this community who live here, who pay taxes here, how they feel about the issue. This is not about folks getting reelected. This is not about anything other than making sure that we have the proper policy in place as it relates to the fluoridation of water. It's a decision that I thought was well debated. Everybody had their opportunity to speak. We heard from a number of people and organizations. And I think if somebody wants to pursue this further, there's other options available. As you probably know, the legislation even allows for this to go to referendum. And I've heard some rumblings that perhaps there might be an effort to see that happen in Windsor, and we'll have to sit back and see if that indeed is the case.
And we'll keep watching too. Councillor Marra, it's good of you to join us on TVO tonight. Thanks so much.
My pleasure. Thank you.
Councillor Bill Marra, City Council of Windsor, Ward 8.
Support Ontario's public television. Donate at tvo.org.